Is this thing still on?
Sounds like they heard us. We are seeing some change.
We need to continue to disrupt the status quo.
And now the work begins.
You are now about to witness the strength of nursing knowledge.
Welcome to the Gritty Nurse Podcast, an unfiltered discussion on health and healthcare. My name is Sara Fung.
My name is Amie Archibald-Varley, and we are your hosts. Our Toronto Star and the Globe and Mail national best-selling book is available now. Get your copy of The Wisdom of Nurses today. You can get a book for purchase at any of your local retailers like Indigo or Chapters, or pick up your book online through Amazon or other types of retailers. It's also available in various different formats like audiobook and on Kindle. If you read it and you loved it, please leave us a review.
Please make sure you subscribe on our YouTube channel where you can watch our podcast in video format. Like, share, and leave a review. If you're listening on Apple Podcasts, Spotify, iHeartRadio, or any other podcast platform, leave us a rating and review. Thank you to all our listeners and sponsors who continue to support us.
Your support makes our podcast possible, and we're grateful for the partnership and for you believing in our work here at the Gritty Nurse Podcast. Stay gritty. On October 7th, many people's lives changed all across the world, particularly folks that lived in Israel. Bombs went off as a result as the terrorist group Hamas attacking Israel. This is a conversation that we need to have because since those attacks, we have seen nothing but devastation in Gaza. This is not a fight between the people of Gaza as well as the people of Israel, although this is how it may seem on the social media. This is actually a fight against two different countries and different ideologies, but we really need to boil it down to its roots. And what we're going to be talking about today as healthcare providers is really bringing and infusing humanity into the practices that we should uphold. And humanity is for all people. So today we will be talking about something very, very difficult, talking about the war that is continuing in Gaza. Although there has been a ceasefire, there still has been over 137 Gazians killed over the past couple days. We need to have a conversation about what our role as healthcare providers are. And there's no best person to have that conversation on our podcast than the guest we have coming up next. Sara, please introduce our guest.
And I just want to start by saying we are putting out a trigger warning because we understand that this is a very difficult topic. It can be very traumatizing for some. So if you need to, as we're going through this episode, please take a break, talk to someone, get the support that you need because we realize this is very difficult, but also a very important conversation to have. And there's no better person to have it with than our guest. And his name is Dr. Yipeng Ge, a primary care physician and public health practitioner based on the traditional, unceded, and unsurrendered territory of the Algonquin Anishinaabe. In his clinical practice, he works in family medicine practice and refugee health at a community health center. He has worked on and studied the structural and colonial determinants of health in both the settler colonial contexts of so-called Canada and occupied Palestine. Welcome, Dr. G.
Yeah, of course. And thank you for having me on your podcast.
Again, we feel this is a really important topic. And I wanted to start by reading a poem, and it is called O Rascal, Children of Gaza by Khalid Juma. O rascal children of Gaza, you who constantly disturb me with your screams outside or under my window. You who filled every morning with rush and chaos, you who broke my vase and stole the lonely flower on my balcony, come back and scream as you want and break all the vases. Steal all the flowers, come back, just come back. So I know, again, this is an episode of something we've never talked about before. But before we get into this episode, Dr. G, would you be able to tell us a little bit about your pathway into healthcare and why you chose medicine?
Um, as I think my experience of being an immigrant is something that I think a lot of people share is not feeling entirely, I think, at home in a place like Canada, a settler colonial state, and also sometimes not feeling entirely at home in the place that my family came from and has its roots. And so I think that searching for identity was something that I constantly thought about going to school in undergraduate studies. And when I was confronted with the realities of settler colonialism here on this land, on occupied Turtle Island, and learning about the legacy of residential schools, the 60s scoop, like the genocide of Indigenous peoples on this land, I had to reckon with what my identity of being Canadian meant. Something that just was kind of handed to me because my parents passed the citizenship test when I was in grade 5. And so I think I really leaned into that experience of wanting to not like to end my own complicity, even though that complicity continues because of the systems that we were just kind of a part of, and what it means to kind of dismantle these systems of oppression, or at least think about those things from the framing of health and putting health at the center of that. And so, learning about Indigenous health in the context of Six Nations, of the Grand River, close to where I grew up in Waterloo, but also close to where I did my undergraduate studies at in Hamilton. Um, was, I think, really foundational for me in terms of what my role moving forward would be in thinking about medicine, thinking about public health, and that kind of set the foundation for entering both of those fields, and continuously thinking about what does decolonizing healthcare and our broader systems, what could that look like? And there's many great examples out there, but I think we need to really contend with that both at home here, but also in many other parts of the world that struggle with decoloniality.
So, in terms of your pathway and getting into medicine, one of the things is that strikes us and strikes in terms of having this conversation. Some might say that your residency sparked some controversy, but we would like to say that it sparked actually a greater conversation. Could you tell us a little bit of what happened and how you came to start having really crucial conversations for those that are listening to the Greeners podcast that might not know a little bit about you?
Yeah, thanks for that question. I mean, I, as I mentioned, like this is kind of like why I went into medicine and also why I went into public health. Like I did a little bit of public health work before going into medical school, and then going into medical school, I thought about doing all these different kinds of fields of medicine, and then also eventually landed back in public health and preventive medicine and also training in family medicine. Um, and during my public health residency itself, I was also studying the settler colonial determinants of health here on this land and also in the context of Palestine because of the issues of settler colonialism. There's just so overt in and in your face affecting Palestinians in the West Bank, in Jerusalem, East Jerusalem, in historic Palestine, in Gaza. And so having known all those things, having studied them, having practiced them, I, like anyone else did, wanted to provide more historical, political context when October 7th, 2023 came around, which was an act of, Palestinian resistance to Israeli occupation and apartheid. And to know what the colonizers' reaction would be in the coming days was also already written by the stances of the politicians in Israel, which were already extremely genocidal on October 7th, October 8th. And so the historical and political context in which violence takes place, in which resistance to colonization takes place, is really important for us to understand the root causes of disease and suffering, the root causes of violence, and we need to be able to talk about those things. And so the very least that I did and many others did around that time was to share social media posts to provide additional context so that people can better understand Palestine, so people can better understand other parts of the world that are deeply intertwined with how Canada, as a settler colonial state, upholds and supports by funding and military commitments to another settler colonial state, Israel, to commit what it's doing, which is genocide, which is part and parcel of what colonialism is. And so by sharing those social media posts, and some of those social media posts were my own, like photos from marches in Ottawa, protests in Ottawa, and also my own travels in the West Bank. All of those things got flagged by uh, colleagues of mine, medical school colleagues who had access to my private Instagram at that time and shared those social media posts to a physician in the community in Ottawa who doxed me and then also sent those posts both to the University of Ottawa, where I was doing my residency training, as well as the Canadian Medical Association, where I was a board member of at the time. And both of those organizations decided to take retaliatory actions against me immediately without kind of hearing really the context in which I was sharing these posts. And the university, for example, decided to go through their own, professionalism kind of investigation, and their own committee found that my social media posts were not unprofessional, were not the things that they said by the faculty. And they actually, went as far as to say that they were unprofessional, racist, anti-Semitic, inflammatory, inciting violence, these kinds of things. And I think it opens up a broader conversation of like the systemic, pervasive nature of anti-Palestinian racism that we're seeing still. Now we're like a year and a half beyond October 2023, how pervasive this kind of racism, dehumanization of Palestinian narratives as told by Palestinians and Arabs and Muslims and really anyone in solidarity with Palestinians. People continue to be disciplined, be intimidated, be bullied, harassed for these views, and to lose jobs, scholarships, grants, that kind of thing. So I understood that my experience is actually not a unique one. It is within this broader context of this climate of anti-Palestinian racism that is actually extremely pervasive within the medical community, within medical schools, actually within many other professional settings, law schools, school boards. The list, unfortunately, goes on.
Yeah, I'm really sorry that that happened to you. And it's really unsettling to hear that your experience is common. And you actually did go onto the ground, right? Like you went to Gaza, and that is definitely something that we want to hear a bit more about, like your journey onto Gaza, what you saw, what you learned. I think our listeners would be really interested.
Yeah, the interesting thing was being being taken out of my residency program in November of 2023, and then later go through this like investigative process, and then later to have been completely exonerated of the things that I was being accused of, but then to also not receive an apology, to not find a restorative like path forward to like repair harm done to me and actually felt by a lot of other people who are close to me, who are watching the case. I had, no path forward with the institution. And the irony of that is, had it not been for their actions, I wouldn't have met so many more amazing, like humanitarian, um, you know, doctors and other healthcare workers that care deeply about equity, who care deeply about justice, who understand the value of decolonizing healthcare. And so it was actually through that experience I met so many more people, and some of those people have connections and have worked on the ground in Gaza for many years. And it was through some of those conversations that ultimately led me to go to Gaza in February of last year of 2024. because I had the time and I was trained as a family doctor, and very little conversation was happening actually about primary care. And actually a lot of that conversation is happening right now because even though there's a ceasefire, it's not a true ceasefire. Like Israel continues to assault the West Bank and Gaza, but the sheer number of bombs have reduced, and so attention is being pulled more towards those chronic diseases, the issues that you would see in a primary care setting, that are so exacerbated because of a lack of all the determinants of health that are required to sustain life, like food, clean water systems, um, uh, shelter. These things are still being obviously being rebuilt and being like replenished through like the trucks of humanitarian aid that are entering. But when I was there in February of last year, um, I think many can appreciate and understand that the Israeli blockade on the Gaza Strip was in full chokehold, and I think it's important to note that blockade existed for 17 years, beyond what we experienced last year, being on the ground. And so when I worked in a primary care setting, in multiple primary care settings in Rafah, um, the things that I wanted to prescribe were food, water, decent shelter, some medications as appropriate. But the only things that we could really bring in at that time were medications. Later, they would be restricted further. Um, and we started prescribing antibiotics to many different kinds of like wound infections, lung infections, gastrointestinal infections that were suspected to be bacterial. We started prescribing the antibiotics that we brought in because the clinics didn't even have antibiotics. Many other medications were in short supply, like warehouses were attacked and destroyed by Israel that held these really important things. But the things that the entire population needed at that time, and actually still arguably now, is like reliable access to nutritious food, clean water. Clean water is so hard to access right now in Gaza still, and trucks are entering with clean water. Like these are not, when the entire infrastructure to sustain life in Gaza for over 2 million people has been decimated and essentially destroyed, it makes it really challenging to provide any kind of meaningful primary care, because as someone who studied the determinants of health, like those preconditions to allow for any kind of health to be maintained have been destroyed, and hence why many have deemed what is happening in Gaza as a genocide. So to provide healthcare and like in this context of genocide, it feels actually like an impossible task, and it feels in many ways complicit, to be a part of a humanitarian industry that allows the world to kind of say, oh, we're doing what we can for the population while they're still being genocided, and sometimes actually providing that diplomatic political cover for the perpetrator, to Israel, to continue that said genocide. And that's still happening with a lack of self-determination and liberation for the people of Palestine, for the people of Gaza.
Yeah, thank you for painting that image of what's happening still in the West Bank and in Gaza, and again, what's happening to the Palestinian people. I think one of the things that I find most frustrating about this conversation is the deafening silence, and you've kind of mentioned that, and I think that this is probably why we're having this conversation today, because there is a deafening silence. And from healthcare providers and professionals all around in relation to what the rule of law is, in relation to the laws that we have around when we're seeing issues related to genocide or protecting hospitals from bombings. Just recently, I even think back to 2 years ago when the word ceasefire was a word that could not be, or could not have been said. I remember being asked to do an interview with the CBC um, in relation to whether there should be a ceasefire. And I remember hesitating myself about whether I should go on national TV and have a conversation. And what it boiled down to me, and what made it important for me to have that conversation and to use the word ceasefire and genocide, where I think we have to remember who we are as healthcare providers and who we are as healthcare professionals. And at the end of the day, yes, we talk about the social determinants of health, but it's not about just talking about them. It's about living, breathing, and doing something about them. And again, there is this silence around speaking about Palestine in general, talking about the atrocities that we are seeing. And it is very, it's the word isn't problematic. It is it is unjust. I find it very difficult to to sit and be in a, as we are people who are talking about health equity and talking about, the things that we need, to know that there are so many people that are suffering daily, and we say and do nothing. And it really rips to me the fact that even at the beginning of your advocacy, not the beginning of it, but when you were speaking openly, that there were people that tried to demonize you. And again, I think this is where we have to speak to, we're not speaking to the people on either side, but we are speaking about the governments, because I think people forget that it's the governments and policies that cause a lot of these things to continue to occur, and the decisions that are made by governments. And I think that, we have a responsibility, we have a duty, as healthcare providers, to say when, there's harm. We have to. That is our job. We, as a physician, you take an oath to do no harm. As nurses, we take a similar type of oath to make sure that we are providing the best care for all of our patients and families. And how can we, as healthcare providers, how can anybody as a healthcare provider say they're doing their due diligence if they do not speak out when we are seeing this type of harm occurring across the world? So one of the things I'd like to say to you, I know that was somewhat long-winded, is what do we have to say? How do we continue to encourage our colleagues, our friends, our family members to speak up when we are seeing this type of harm? Because, I think it's one thing when it's happening to you directly, right? We're gonna, if it was your aunt or your sister, your friend or your family member, we're gonna jump up and say something. But when it's not affecting someone directly, it's easy for you to shut the TV off, or for you to not listen to that image on the radio or that reel that comes up. What do we need to say to our colleagues to get them to care?
It's an important question as to like how we encourage others to have the courage to speak up, knowing that speaking up is not an end in of itself, right?
Right.
It's really often. It's not enough to, say that something is unjust in this world. We actually have to commit to material actions, solidarity actions that usually and most often put something at risk or put something on the line.
Right.
Uh, to be able to be in meaningful and authentic solidarity with people who are um, like oppressed, people who experience structural oppression in this world. And that happens even in our own communities, and in all the ways in which capitalism, colonialism, structural racism has its deep roots in dehumanizing um, like Black and Indigenous communities, people who use substances and drugs, people who are homeless or houseless, um, people who are differently abled, like the queer and trans communities. Like we see the ways in which dehumanization is so easy for the far right, for fascism, to actually use to gain political, points or votes. And we have to understand the ways in which that's happening in our communities all around us, how it affects people around the world, and know that like speaking up is part of, I think, building the courage to kind of tie these things together, um, like logically, and then once you're better positioned in that kind of political, sharpened political analysis, then you're better able to, I think, speak on it. But then know that the solution is like collective community organizing, to be able to advance meaningful solutions to like combat far right extremism, white supremacy, fascism, which is at the root of why these things are just so pervasive and deep within settler colonial states or entities, whether it be Canada or the US or Israel. And so um, I, I I think like one thing that I want people to reflect on is like how are we as individuals, how am I, and how are our communities, how are our institutions, how is our government like complicit? And these are really important things to think about when people are struggling with very real issues themselves, and how do we connect those issues to the struggles of other people who are oppressed in other parts of the world, because our liberation is truly intertwined. Like I think about in Ottawa, for example, where I live, um, we know that there are companies who are based in Ottawa that produce military parts for the F-35 jets that are made in the US and then are shipped to Israel. So then they could be flown to Gaza and drop 2,000-pound bombs on civilians. And so know that our taxpayer money is subsidizing that, is facilitating that. Our government is facilitating that. Or the companies in our backyards around us are facilitating that. So I think to be able to understand these things better, then we're better able to, I think, articulate it and actually move towards solidarity work that helps to dismantle these forms of complicity.
Yeah, thank you for that answer. I think that you painted a connection that not many people would have thought of. Just the fact that there are many ways that we're complicit, even though, being silent is being complicit. Having a company, like you said, that supplies parts to make weapons essentially is, we're not helping the effort. And I also feel like a lot of times when people see things that make them uncomfortable, hear things that make them uncomfortable, the natural inclination is to shy away from it, like to take a step back, not look at that image, not listen to what people have to say. And, people are constantly being bombarded. I also think that over time, this can desensitize people as to what's actually happening. And I know that that's not a reason to not do something about it, but is there a way to kind of stay human and not be desensitized to all the information that's coming at us?
I think it's hard in this like capitalist colonial neoliberal society that we live in, that the ideologies of like um how we try to take care of ourselves can sometimes be in conflict with how do we take care of the movement, how do we take care of people in community. And so I think we have to radically rethink what it means to be well in society when there is no way to be well in a sick society, in a society that is deeply racist and colonial and capitalist. Like by definition, that society is sick because it is extracting so much from communities and the land and resources and putting that profit within, a very select few people in this world. And to know, like, to bear witness to genocide, whether it be closer to home or on the other side of the world, know that we live on one shared planet. What happens in other parts of the world have a deep, interconnected impact on other parts of the world. If we think about just this huge thing that happened that I think many people forget about, especially in healthcare, people have really forgotten about it, is like the COVID-19 pandemic. Like what happens in other parts of the world have a deep impact on our communities here at home. And so knowing like the ways in which these things are interconnected is really important to how we, I think, be in community with one another and find ways forward that do not isolate ourselves as an individual, and then we think about this like neoliberal way of like self-care, like I will take care of myself, and like I think like stepping back and resting, that is really important. But I think one of the biggest lessons I've had over the past year and a half is the ways in which to heal from collective trauma and grief and rage from bearing witness to genocide, a genocide that is supported and funded by our taxpayer dollars, by our Canadian government, is to create things, is to be in community, is to work with other like-minded people to reimagine a world without capitalism, without colonialism. And part of that is also political education. And so one of the things that I've been working on is with other folks in Ottawa to work on popular political education as a way to also heal ourselves, because when we're providing resources and materials to other community members that choose to be in community with each other, and we're helping each other in this way, this is, I think, part of the healing process of so much like grief and trauma and rage that is built up. And that work comes from a deep place of love. And know that I think a lot of the times when people this past year, especially myself, like feel a lot of rage, a lot of grief, a lot of trauma, it's because we are human. Like we have that humanity still intact. I worry for others that don't see things for what they are, choose to turn a blind eye, and it actually makes them less human. I think that's like the really awful consequence of the politics of dehumanization, is it not only dehumanizes like a very specific population through like those systems of oppression, but it also dehumanizes other people that choose not to pay attention and choose to sometimes actually silence out of a place of fear. And I think to break through that fear is really, really important. It's always like, I think, a work in progress as to like how do we do that as individuals, do that as collectives, as a community, and do it in strategic and effective ways so that we don't get burnt out, so that we build sustainable movements for collective liberation. For, like this is, these are kind of, I think, words that are used a bit too like easily with not a lot of nuance and complexity as to how do we actually do it. And those conversations happen at the local level, and how we treat each other within the movements that we're trying to build.
Yeah, if you could think of, I know you mentioned a couple of different things in terms of a call to action, but could you think of things, maybe just for our listeners, one or two things that they can do to be a part of this movement in terms of, creating awareness, or even just something tangible that they can do to be a part of the change that we need to see in terms of the conversations related to what's happening in relation to what's happening to Palestinian people.
Mhm. Um, I mean, I think one of the biggest things that I would recommend is to like listen and learn from Palestinian narratives, from people who are on the ground in Gaza, in the West Bank, in historic Palestine, in Jerusalem, who are reporting about their experiences as they're living, breathing, um, like examples of what it means to live under apartheid occupation, brutal like military occupation and colonization, and um, and there are many calls to action from these experiences, from these narratives. I think one of the most powerful things that we can do as individuals and as people outside of Palestine to be in solidarity with Palestine is to really pick up calls to action related to the BDS movement, boycott, divestment, and sanctions, because that is something really tangible for us to break ties, break the complicit ties, whether it be through the things that we buy or through the ways in which our institutions, whether it be a school or a workplace, or if you're working, like your pension, like all the ways in which these things or investments, like I had a colleague reach out to me about wanting to divest their own investments. So like these are very real ways, tangible ways in which we can break those ties to Israeli apartheid, and is actually not only like morally the right thing to do, but it's actually legally an obligation now because of the multiple rulings by the International Court of Justice on plausible genocide, but also on the illegality of the occupation in the West Bank and the need to break these ties. To summarize, I think center, listen, and truly learn from Palestinian narratives as they've existed. Like there's so many books, so much material out there, because the genocide didn't start October 7th, 2023. It began, and actually arguably like before even the Nakba began in 1948 with another form of occupation under the British rule. But to know that these issues have lasted and persisted for decades and generations, we have to go back to some of those existing materials and really dig into them, as we need to do for many other movements for liberation around the world, including our own communities. And the second would be, so the first is like political education. We really, really need a solid political analysis. And that work can happen, within ourselves by picking up a book, or it can happen with book clubs. It can ideally happen in community by creating something that welcomes other people in, that creates a larger conversation. That conversation can live on and on. And then the second, I think, would really be like looking into BDS, and not only how we can do it as individuals, but how do we do it as a collective? Like, how do you have a conversation with other people, with your coworkers, with your institution, your school, like to be able to divest, for example. These are really tangible things that will spark not only tangible change, but also further conversations that will live on and on and on.
I think those are some really great ideas. And I think that this gives our listeners some tangible actions that they can take. I think a lot of it is just people feel paralyzed or they feel overwhelmed because the situation is so grave and they're just not sure what they can do. So I think that was really helpful for you to share some of these things. Yeah. And I've certainly learned a lot from this episode. And just to kind of round it out, is there anything else that you wanted to briefly touch upon or share before we close off this episode?
I think we've talked a lot about it, a few different things, and I think I hope it's helpful for folks to kind of dive into like the question of Palestine. I really hope um, like we understand that like how important it is to like talk about Palestine, but I think it's really, really, really important to know how Palestine doesn't happen within a vacuum. Like the issue of Zionist settler colonialism in Palestine, the occupation, the apartheid, the genocide, it does not happen within a vacuum. There are many other systems and forms of oppression that happen around the world that are also complicit with what's happening in Palestine, in our own backyards. And I think I already spoke about it, but it's just like knowing these ties, knowing the ways in which like the police in North America, in the US and Canada train with the Israeli genocide occupation forces, and they learn from each other. They share like technology to surveil like communities of color, to dehumanize them, police them, over police them, and criminalize them. Uh, that's happening here, and so to know all of these connections, and as it like fits under a framework of like white supremacy, settler colonialism, fascism, far right fascism, I think like that political analysis, I think we need to all get to so that we can be better organized, as what we're seeing, for example, just south of where we are in the US, with what's happening with Trump, like, and what's happening with possibly with the Canadian election, federal, provincial, like these are very real things that will have decimating effects on communities. Like it will kill people. It has already killed people. I think about the impacts of demonizing and vilifying people who use substances and harm reduction services in Ontario. Like it has already killed people. And so like knowing these connections, knowing that it fits under this framework, like that is what we're up against. We're up against fascism. We're up against white supremacy. We're up against Zionism. Like we need to sharpen our politics and understand how these things are intertwined to be able to better be organized against it.
Yeah, no, thank you for sharing all of that. And I think that one of our due diligence too will to make sure is to ensure that we add some of your suggestions in our show notes as well. If you could send us some of those books, we'll add them in as well. And just as we started the episode, we want to end the episode with a poem as well. We know that you've got to go because you're busy. But this poem is by Iker Shiraz, and it's named Your Civility is a Siege. So I'll quickly read this here. I hope we keep the emotional, analytical, political, irrefutable clarity of our lives turned into rubble. I hope we keep mystifiers at bay, nuances of tools of genocide on the stake, no mercy for executioners and their accomplices. I hope we heed the call to fight with indignant, angered love, to not falter whether in trouble or solitude, isolation or solitary, barrages of lies or simple exhaustion. I hope we keep when we write, when we think, when we speak, when we feel uncomfortable, clarity of opposing nothing but the sheer death by colonizer, patriarch, boss, creditor, master. I hope we do not modulate our discourse, do not capitulate in words, do not forgo our capacity, our duty to fight, our dignity, our refusal, as a friend once said, to be turned into a monster. I hope we keep the emotional, physical, political, analytical, irrenounceable clarity that your moderation means extinction, your complacency, attrition, and your civility, a state of a siege. Your civility is but the expression of your wish of death and ultimate destruction. I hope we understand that every line is a battlefield, every compromise an extortion, every verse an expression of forlorn Al Adonis, a resistant Palestine. I hope we keep the apocalyptic lucidity that your civility is nothing but a siege. Thank you, Dr. G, for coming onto the Greeners podcast. We really appreciate your voice. We hope to continue to hear from you and hear from you. Your work is valued, and I want you to understand that we completely respect your work, and we have work to do too. So thank you so much for coming on the Greeners podcast to have this conversation with us.
Thank you so much for having me.
Thank you. We really appreciate your time. Thank you for listening to the Greeners podcast. If you have any suggestions or want to hear a specific topic, email us at grittynurses@gmail.com. That's grittynurses@gmail.com.
We are also speakers and authors available for engagements related to advocacy, nursing, mental health, and health policy. Please connect with us.
We want to take a moment to express our deepest gratitude to our incredible sponsors. Their generous support has been instrumental in making our podcast a reality.
Thanks to their belief in our mission, we're able to bring you engaging content and connect with our amazing community. We're truly grateful for your partnership. Thank you.